Did you know liver disease causes around 2 million deaths every year? About 4% of all global deaths? The liver is your body's chemical powerhouse. It performs over 500 vital tasks like balancing blood chemicals, making bile, filtering toxins, and helping your blood clot. It works quietly until it starts to fail. And when it does, toxins build up. You bruise easily, turn yellow, your belly swells, and your brain can slip into a coma. Without a transplant, chronic liver failure is fatal. The scariest part? Liver disease is often a silent killer. With no clear symptoms in the early stages, the damage may already be severe. But here's the good news. Today, we'll show you 7 early warning signs of liver trouble that many people miss, plus simple, practical steps to protect your liver. Don't wait until it's too late. Your health, and the people who love you, depend on it. Let's dive in and spot the signs of a struggling liver before it's too late. Number 1. Yellow skin or eyes. You look in the mirror one morning and something feels off. Your eyes, they look a little yellow. Could it just be bad lighting or something more? That yellowing, known as jaundice, is often the very first warning sign of liver disease, and sometimes the only one you'll get. Jaundice happens when a substance called bilirubin starts to build up in your bloodstream. Normally, your liver filters it out, packages it into bile, and sends it safely out of your body. But if your liver is inflamed, damaged, or if a bile duct is blocked, that bilirubin doesn't leave. It spreads through your tissues and turns your skin and the whites of your eyes yellow. It's not just about appearance. Jaundice could be a sign of acute hepatitis, alcohol-related liver damage, or even late-stage cirrhosis. If you notice this yellow tint, don't ignore it. Don't blame it on diet or vitamins. Jaundice doesn't show up for no reason. You need to get a liver test right away, because your eyes might be the only place your liver has to cry for help. And if you listen now, you might still have time to act. 2. Abdominal bloating and leg swelling. Have your pants started to feel tighter, even though your weight hasn't changed much? Does your belly feel unusually full or hard, or your ankles swell by the end of the day? This might not be just bloating. It could be fluid retention, one of the clearest signs that your liver is in trouble. When your liver becomes scarred, like in cirrhosis, blood can't flow through it easily. This builds up pressure in the veins, especially the portal vein, which leads to fluid leaking into your abdomen. That swelling is called ascites, and it can cause serious discomfort. At the same time, your liver may stop producing enough proteins, causing fluid to collect in your legs, ankles, and feet. You might see sock marks, or find your shoes no longer fit by evening. This isn't normal. It's your body telling you that your liver is struggling to cope. Cutting down on salt can help. Resting with your legs elevated might reduce swelling, but make no mistake. This is not just a cosmetic issue. In serious cases, doctors may need to drain fluid directly from your abdomen. Don't wait until you're gasping for air from the pressure. If you're swelling, your liver may already be crying out for relief. 3. Persistent itchy skin. What if your skin started itching and just wouldn't stop? No rash, no allergy. Just this deep, maddening itch, day after day. This isn't about dry skin, it's about your liver. When your liver can't process bile properly because of blockage, inflammation, or damage, bile salts and toxins start to build up in your bloodstream. And they don't just stay in your blood, they seep under your skin. The result? An itch that feels like it's coming from the inside out. It might hit your arms, legs, back, even your palms or soles. And the worst part? Scratching doesn't help. Lotions don't touch it. It can keep you up at night, ruin your focus, even drive you to tears. This kind of chronic itching often shows up early in diseases like primary biliary cholangitis, chronic hepatitis, or bile duct problems. If you've been itching for weeks without explanation and nothing seems to help, get your liver checked. Blood tests and imaging can uncover what your skin is trying to say, because sometimes the loudest cries for help are the ones that don't leave a mark. Hazards 4. Dark urine and pale stools. You go to the bathroom and notice something strange. Your urine looks dark, almost like cola, and your stool, it's pale, chalky, not at all what it should be. These changes are big clues that something's wrong with your liver. Here's why. Your liver produces bile, a digestive fluid that gives stool its brown color and helps break down fat. But if the liver's bile production is reduced, or if bile can't reach your intestines due to blockage or disease, your stool turns pale. Meanwhile, bilirubin, the same substance that causes jaundice, gets dumped into your urine, turning it that dark amber or brown. This isn't a one-off symptom. It often appears in conditions like hepatitis, bile duct obstruction, or even gallstones. And if you're seeing both signs at the same time, dark pee and pale stool, the alarm bell should be ringing. These are the kinds of signs your body gives before pain even starts, so don't dismiss them. Talk to your doctor, get a liver function test, because your toilet might be sending you a message your liver can't say out loud. 5. Chronic fatigue and weakness. Do you feel exhausted, no matter how much sleep you get? Struggling just to get through the day? Like your body is running on empty? This isn't just being tired. It could be your liver failing to keep up. Your liver plays a huge role in energy regulation. It filters toxins, stores fuel, and helps metabolize the nutrients you eat. But when it's damaged, from fatty liver, hepatitis, or cirrhosis, that whole system starts to break down. Toxins like ammonia build up in your blood, and even reach your brain, causing mental fog, confusion, and crushing fatigue. You might feel like you're coming down with something that never quite hits. The scary part? It creeps up slowly. You might not realize how bad it's gotten until one day you can't climb the stairs or remember why you walked into a room. If you've been dragging for weeks and can't explain it, don't brush it off. Talk to your doctor. Ask for a liver panel. Your body isn't lazy. It's trying to survive. And fatigue might be the first whisper of something much more serious. 6. Nausea and loss of appetite. Food you used to love now makes you feel sick. Meals don't excite you. They make you feel bloated, full, or just off. This isn't just a stomach bug. It could be your liver waving a red flag. The liver produces bile to help digest fat. But when it's inflamed or overworked, that bile production drops and your digestive system suffers. At the same time, toxin buildup can trigger nausea as your body tries to purge what the liver should have filtered. You might feel queasy in the mornings or lose your appetite completely. This can lead to unintentional weight loss, malnutrition, and muscle wasting, especially dangerous if you're already managing another illness. These symptoms often appear in acute hepatitis or advanced fatty liver disease, and they're easy to miss because they feel like just a stomach thing. But if you've been feeling off for more than a few days, get checked. Eat small, bland meals, stay hydrated, and most importantly, don't ignore a disappearing appetite, because when your body stops wanting food, it might be trying to survive something deeper. 7. Easy bruising and bleeding. You bump into the table, and the next day, there's a dark purple bruise. A tiny cut bleeds longer than it should. Your gums bleed when you floss. These aren't just annoyances, they're warning signs that your liver might not be making enough clotting factors. The liver is essential for blood clotting. When it's damaged, that your body can't stop bleeding the way it should. Bruises appear more easily. Periods may become heavier. Nosebleeds more frequent. In serious cases, you may see small red dots, petechiae, from blood leaking under the skin. These signs often appear after significant liver damage, but in some cases, they're among the earliest clues. It's not just about thin blood. Liver disease can cause low platelet counts too, as a swollen spleen traps them. That means your blood has fewer tools to do its job. Don't ignore it. If you're bruising easily or bleeding in unusual ways, speak to your doctor. Avoid over-the-counter blood thinners like aspirin. Eat foods rich in vitamin K, and get your liver checked, because the bruise you think is harmless might be the liver's way of saying, "I'm not okay." These early warning signs are more than random symptoms. They're your liver quietly pleading for help. The liver is our unsung hero, performing over 500 vital functions every single day to keep us alive. Yet liver disease often creeps in silently, only showing symptoms when it's almost too late. Recognizing those subtle signs early can literally be life-saving. If we catch liver problems in time, this amazing organ can heal itself, but once too much damage is done, the harm may be irreversible. So please, do not ignore these signals. Take them seriously. If you or someone you love has any of these warning signs, get checked as soon as possible. Your liver works tirelessly for you. You owe it to yourself to protect it. Share this video with others. Spread the word. You might save a life. Start protecting your liver today.